It's World Mental Health Day, and the overall objective is raising awareness of mental health issues around the globe and mobilizing efforts in support of mental health. That's the thrust of UN Resident Coordinator Mikiko Tanaka, who says that persons with mental and psychosocial disabilities represent a significant proportion of the world's population.
However, nearly two-thirds of persons with mental health conditions will not seek treatment for their condition. Stigma, among other issues, is a significant determinant of quality of care and access to the full range of services required by persons with mental health conditions who also have physical complaints. In some countries, the absence of community-based mental health care means the only available care is in psychiatric institutions, which are often associated with gross human rights violations, including inhumane and degrading treatment and living conditions.
Ms. Tanaka addressing the gathering at World Mental Health Day activities on Wednesday. She explained that many persons who suffer some form of mental illness are often afraid of seeking treatment because of the stigma, but that a mental health disorder can be treated effectively.
Despite these challenges, a great deal of mental health conditions are both preventable and treatable, especially if we start looking after our mental health at an early age. In Guyana, the United Nations continue to work to ensure that the 2030 agenda is fulfilled and that no one is left behind, and particularly through the PAHO, Pan American Health Organization, and the World Health Organization works vigorously to ensure that persons with mental health problems are no longer marginalized.
Meanwhile, PAHO WHO resident representative in Guyana, Dr. William Adukro, stated that depending on the local context, certain individuals and groups in society may be placed at a significantly higher risk of experiencing mental health problems.
Vulnerable groups may include members of households living in poverty, people with chronic health conditions, infants and children exposed to maltreatment and neglect. Adolescents are not immune from that, as we've said already, and they are exposed to substance abuse, minority groups, indigenous populations, the elderly, people experiencing discrimination and human rights violation, lesbians, gay, bisexual, transgender, prisoners, and people exposed to conflict and natural disasters.
Dr. Adukro added that more focus needs to be placed on youths since adolescence is the transitional stage for physical and psychological development. For many, these are exciting times, but these can also be times of stress and apprehension, he said.
In some cases, if not recognized and managed, these feelings can lead to mental illness, which must be addressed in the early stage before it becomes chronic. Half of all mental health conditions start by the age 14. I think if we know that fact and we act on it, we can prevent a lot of the sequelae that we see later on in life.
Reporting for HGP Nightly News, I am Kristen Macklingham.